Well, hello, Riyadh. Thank you very much for coming after such a busy week. Um, I'm here today. I'm going to discuss with you how Ecoverse solutions can be used to build a smart and resilient future. Or, translation, put in a very much more simpler way, I will demonstrate how we can harness the potential of digital and advanced technologies and use them as an exponent of environmentally conscious, sustainable designs. I'm Sandra Woodall, a Fellow of the Royal Institute of British Architects, a Fellow of the Academy of Urbanism, and I'm Design Principal at Tangram Architects and Designers, working from our MENA region studio. Tangram are architects who originate from the UK. We've delivered social infrastructure projects globally for 2 generations now. That's hospitals, schools, housing, community buildings such as libraries and sports facilities, and work in the public realm. We've worked internationally since our very first formation, and we've worked here in the Kingdom since we designed the hospital for Aramco in Al Khafji, up by the Gulf Coast on the Kuwait border in 1990, and which was equipped, commissioned, and handed over in 1995. And I've lived and worked in the Gulf ever since, so that's just over 30 years now. Today, I will showcase the radical transformation that we, as a traditional architecture practice, have undertaken as we embraced and became the most unsuspecting founders of our very own tech startup. Through collaboration, based on excellence and vision, with the aim of providing integrated and proactive services to the industry, tangramMETA was established in partnership with one of the leading emerging technology companies in Germany. Together, we strive to chart the visionary future of architecture and construction by harnessing the potential of digital and advanced technologies to be influential in shaping the future of climate tech. So how on earth did this happen? 2 years ago, we were invited by a client to develop what started out as a prototype hospital to support the development of their new nationwide health reform program. The client has an urgent need to deliver almost 40,000 beds spaces by 2030, and need to deliver 150 new hospitals and to radically alter, improve, and retrofit 600 existing ones on their network. At the end of our initial meeting, the client said to me, "Sandra, I need you to design sustainable green architecture for me that will fulfill all of our future healthcare needs." Green architecture, all of our future healthcare needs. How loaded is that? Well, let me tell you. I'll give you some context, the very sad facts of the healthcare industry today. Currently, hospital buildings as a typology are notoriously high in the continual usage of energy, power, and water. That's 24/7, 365 days a year. Whilst they release 2.5 times the greenhouse gas emissions of most similar-sized commercial buildings. And the production of waste is constant, which can be hazardous and toxic in many cases. 6% of this waste is made up of nitrous oxide, a toxic gas which is 300 times more destructive to the environment than carbon dioxide. In fact, if the global health industry was to be classed as one country, this one country would be ranked 5th worst performing country in the world when it comes to greenhouse gas emissions. Here, up by the top right, it would knock Japan right off its 5th place spot. The World Health Organization has declared nitrous oxides to be at critical levels worldwide, It's a major factor in poor air quality, one which increases cardiovascular and respiratory diseases. It reduces quality of life and can lower life expectancy, which gives us even greater health, societal, and environmental challenges than what we expect today. Typically, as patients, the buildings that we visit to make us better when we are ill are the very ones that are unintentionally contributing more than any other to many of our actual health issues in the first place. In creating a hospital of the future that optimizes eco-designs and sustainable solutions, we must design in accordance with the World Health Organization's 7 elements of a climate-friendly hospital. Very familiar to those of us who work in sustainability. Energy, carbon, power, waste, transportation, etc. All these are devised to support the United Nations Sustainable Development Goals, and we must work to achieve a radical reduction in carbon, in energy, in water, and in waste footprints. So it's no different to any other building, really, just the benchmark is set so very, very low. So today, we are working in very stark contrast to these 1980s designs that originally brought us to the region. But we saw this coming. For over 4 decades now, in healthcare, we work with a large national network scale of project delivery with clients that are ministries of health globally to deliver projects that are networked across national boundaries by clients who are providing health services to their entire populaces. For the last 7 or 8 years, we've been more and more working with these Ministry of Health's own departments of health reform. So even before the cracks in the system were exposed to all of us during COVID, our clients knew that the spaces and the skills needed in healthcare, as indeed in many other sectors as we can see today, are changing. And we as designers, all of us, we have to address this to ensure that we maintain relevance in what we do and that our clients do not go elsewhere for their future solutions. We, as designers, need to acknowledge our clients need this, and we must create spaces that not only are different, but are designed differently too. In a recent survey, half of all clinicians and 3/4 of all medical students are currently seeking additional training to better prepare themselves for innovations, digital and technological advancements that will change the face of how they will need to work in the future. Already we have robotic surgery taking place in the region. Last summer, the world's very first net zero carbon surgery took place at a hospital in the UK. And it also, in the survey, 71% of doctors and 68% of nurses globally believe that their jobs have changed considerably in the past decade. And physicians, residents, and medical students expect that almost 1/3 of their duties will be automated in the next 20 years. Our hospital buildings today aren't equipped for this. They're designed to a past model. Our clients know that they need radical change as they embrace the ongoing fast-paced medtech innovation and enhancing a new digital identity. They need to bring the next generation of telemedicine that centralizes digital cloud technologies, artificial intelligence, robotic process automation, and now we need the everyday mainstreaming of what we did know as metaphysics. No longer is metaphysics unreal. Metaphysics is becoming real. So today, I'll show you an Ecoverse case study of our hospital of the future. This vision is, it's a paradigm shift. I know we don't like using that term. It's a response to global and pressing health, social, and environmental issues. We have realigned our expertise and a track record of delivering a sustainable built environment with the delivery of healthcare projects. Is that okay? Okay. Our approach challenges, rethinks, remodels, and redefines health service delivery by peeling away the areas within the clinical setting that need not be in a costly, physically built space, and develops a radical reduction in carbon, energy, water, waste, and, to the delight of our clients, capital costs, to deliver a solution that becomes a hospital without walls. To enable true equity and inclusion, to bridge the geo-socio-economic or even the generation divide, to support the virtual spaces which in turn support the physically reduced built hospital spaces that combine in the new networks that we're creating, we add cyber clinics. Cyber clinics become an important part of this national network. Built across the country to offer centres accessible to all, no matter how remote or how digitally challenged a patient may be. With uninterrupted power and internet, kitted out with the hardware and software needed to connect to their clinicians. This gives us a network that will resolve cross-platform barriers and challenges. Based in these cyber clinics that are scattered around the communities, path labs for sample collection before or after telemedicine or online consultations, a cafe to break the fast if needed as the patient waits for results and for his consultation with the doctor. Pharmacies can also be based here to dispense direct to patients using these clinics or to deliver locally into the community. As part of this program, we introduce a new green strategy to the physical building stock. We offer a new modern methods of construction delivery options and moving more of the building into an off-site assembly setting in a factory-to-frame approach for the physical built parts of our network. And we embrace digital technology to move seamlessly from concept to construction. This reduces carbon, transportation, waste, risk, and optimizes costs and program, along with minimizing the impacts that the building will have on the environment. This is key for the delivery of any future hospitals, which are the very microcosms of our cities, and will give us much more scope as we design for improved adaptability, disassembly, and reuse. For our physical spaces, as in all good designs, we must ensure that natural light, calming interior designs, improved internal air quality and comfort levels that include noise reduction are all combined with the psychology of color, of textures, and of inclusion in the building at one with nature, both internally and externally. Creating a therapeutic, healing environment to make hospitals healthier places to stay, to visit, and to work in. We must create the spaces where patients will be able to meet remotely with their clinical teams. Clinicians who can collaborate, meet, teach, and train with each other in these spaces. Designed using evidence-based design, spaces that put people first. Spaces in the metaverse. It's growing ever more easier and cheaper to deliver healthcare direct into patients' homes for patients who typically consult their clinicians for management of chronic health conditions, for the follow-on consultations from initial treatments and initial surgeries. And patients already at home use many apps to connect their smartphones by Bluetooth to sensors for blood sugar levels, for monitors for blood pressure, and even for the scales to weigh themselves in, etc., etc. And all of this data, with information of times, durations, and daily patterns, is already remotely accessed by their doctors and other clinicians on their treatment pathways. Moving such consultations to a home or work-based setting reduces the program of spaces needed to be physically delivered in any new hospital. As we heard earlier on digital twins, again, we use digital twins differently in this scenario. They're provided for scenarios where we can replicate in vivo conditions. There's no longer a need for person-to-person condition to take place, allowing education and training to be undertaken from anywhere in the world. For medical device design, companies can develop and refine ideas faster, leading to a more effective, safer medical devices hitting the market as improved testing timescales are facilitated by digital twins. Surgical simulation training gives healthcare professionals better ways to share, practice, and learn new skills and procedures using virtual reality. Its analytics enable professionals to measure engagement and proficiency. This is far more time and cost effective without the need for real surgical theatres. This allows experience to be gained anywhere at any time without the actual need to practice on physical patients. Put simply, in medicine and pharmacology, with digital twins, we're able to do huge amounts of digital experiments that minimize the number of wet experiments that need to take place in costly physical spaces, reducing our physical built footprint. And by developing and using web-free, immersive solutions, the patient, the consultant, and much wider collaborators and stakeholders can be connected from any setting or location that they so choose. This will offer more convenience, less time wasted, less transport, the carbon used for transport and the time, less economic costs, and which can all be achieved in the delivery of a much more patient-centric health service. To deliver hospitals, and in fact any building of the future, we need to start to design and build differently today. So as we have done, take a look at the possibilities that are out there. When you're working in the metaverse, you don't need to work in cartoon worlds and game worlds. You don't need candy floss trees. There are many metaverses available. Some of the platforms even offer free land. I know the likes of Mono or Spatial.io, when we first started looking, did. So get yourself connected. Take a look. See how you can design in the metaverse. You don't necessarily need Bitcoins. You don't need other NFTs or millions of dollars to start. We did it. And despite all the hype, you don't actually need virtual reality headsets. If your client runs the health service for an entire nation, there really is no reason why they can't create their own, a purpose-made metaverse that is their own to deliver their services from, or a medverse, as it's now becoming known in healthcare. Developed initially for the expansion and improvement of delivering networked healthcare services to enhance patient outcomes and to optimize health system efficiency by best utilization of telemedicine and robotics to reduce the amount of patient hospital visits, and to substantially deliver healthcare equally to those even in the remotest locations in the world. We now offer customized digital platforms and build user-friendly apps to support digital health strategies, virtual health innovations, e-health delivery, and virtual care services, which blend human experiences with leading health delivery from around the world in the continuous pursuit of new innovations. Good design matters, whether it is real or virtual worlds. A fundamental transformation in the possibilities of design has already occurred, freeing us up to be much more creative. We're now designers and builders of virtual spaces, and we must start to shape the interfaces inherent in this new software with our more traditional ones, and design how we engage within them ourselves far more seamlessly. By combining physical and virtual worlds, we can use technology as an exponent of sustainable design. We can build less on this earth. We can combine these worlds to create an Ecoverse, one that combines the physical and the virtual, which offers us solutions to build a smart and resilient future for people and planet. Believe me, if architects like me can create an award-winning tech startup and launch our client's very first virtual reality hospital in less than a year, every one of us here is capable of doing anything. Thank you.